The reticular layer is the deepest portion of the dermis, and it makes up about 80% of dermal thickness. I wrote on a previous slide between 70 and 80%, so it's somewhere in that ballpark. The collagen provides the strength and resiliency. Remember, after all, it is dense, irregular connective tissue. So the collagen is going to be going in all kinds of different directions. It binds water to keep the skin hydrated. It has what's called a cutaneous plexus, which is a network of blood vessels between the reticular layer and the hypodermis. And the extracellular matrix has pockets of adipose cells. So we don't have the level of adipose cells that we have in the hypodermis, but we have a few of them there. Another important feature of the reticular layer is what are called cleavage lines. And cleavage lines are going to represent separations between underlying collagen fiber bundles in the reticular dermis. They run circularly around the trunk and longitudinally in the limbs. So you can see them circling the trunk here and then longitudinally in the limbs. So the reason these are important is surgeons do take them into consideration, especially um, for cosmetic surgery. They try to make the surgical incisions parallel to the cleavage line so that there is better healing. So the cleavage or tension lines are in the reticular layer, and they're caused by many collagen fibers running parallel to the skin surface. They're extremely invisible, but they're important to surgeons because the incisions are parallel to cleavage lines and they heal more readily. So another feature of the reticular layer are flexure lines of the reticular layer, and they're dermal folds at or near joints. So the flexure lines, they form where the dermis is closely attached to the underlying structure here. So you can see the arrow pointing out a few of them. The dermis is tightly secured to deeper structures, and the skin's ability to slide easily for joint movement causes these deep creases. And as you can see from the diagram on the right-hand side of your slide here, they're visible in the hands, wrists, fingers, soles, and toes. One of the homeostatic imbalances for this chapter is what is called stretch marks. And technically, they're called striae. Extreme stretching of the skin can cause dermal tears, leaving these silvery white scars called striae or stretch marks. And acute short-term traumas to skin causes blisters, which are fluid-filled pockets that separate the epidermal and dermal layers. And we'll talk about blisters later on in the chapter when we get to types of burns. Our next slide is on skin color, and there's three different pigments that you should be aware of for skin color. There is melanin, keratin, and hemoglobin. And these pigments are visible on the surface of the skin. The first one, melanin, is made in the skin, and it's made by melanocytes, as you already know. So the more sun that you get, the more there's need for this protective shield, and the more melanin will be produced. But again, that does not mean that you should not wear sunscreen, even for somebody that has a darker pigmentation. So even black people need to wear sunscreen. And it's important that you wear an SPF of at least 15. Studies have been shown that there's a very small, extremely small increase when you go above SPF. For example, you only get like a 1 to 2% increase going to a higher SPF, and it's more expensive. So the two forms of melanin are reddish yellow and brownish black. These skin color differences are due to the amount and form of melanin. Freckles and pigmented moles are local accumulations of melanin. Carotene is a yellow to orange pigment. So think of carrots, for example. It's most obvious in the palms and the soles. And one of those reasons is due to the stratum lucidum. The stratum lucidum is almost a clear um, colored stratum. So any pigments that are deep to that are going to basically shine through to the surface of the skin. There was a silly episode of Scrubs many, many years ago where there was a patient who they called Carrot Man. And it actually can really happen to people. If they have way too many carrots, they could get a yellow to orange pigment that could show up in their palms or their soles. So this carotene does accumulate in the stratum corneum, which is just superficial to the stratum lucidum, also in the hypodermis. The third pigment is hemoglobin, and this provides a pinkish hue of fair skin due to lower levels of melanin. So we would tend to see this more commonly in people that are super white, people maybe of like an Irish or Scottish descent, for example. But hemoglobin is what transports oxygen. And when, let's say that you suddenly become embarrassed, the blood is going to flow to the superficial tissues of your face, and your face is going to turn red. There's other reasons for this redness also, and we'll be talking about those in a couple slides. So a clinical homeostatic balance is excessive sun exposure does damage skin. So be careful out there in the Florida sun. What happens is elastic fibers are going to clump, causing skin to become leathery. I'm sure you know of somebody who has spent most of their life in the sun, and now their skin is leathery. It depresses the immune system, causes alteration in DNA, and may lead to skin cancer. The UV light also destroys folic acid, which is needed for DNA synthesis, so it could be dangerous for developing embryos. Also, there is photosensitivity that's increased in reaction to sun. In fact, some medications like antibiotics and antihistamines are photosensitive. So if you take those medications, the pharmacist will actually warn you to stay out of the sun while you're taking them. So the clinical homeostatic imbalances that are associated with these pigments can indicate diseases, and you should know these. So cyanosis looks like blue skin, and it's because of low oxygenation of hemoglobin. The opposite of that would be erythema, which is redness, could be due to fever, hypertension, inflammation, or allergy. When someone has anemia or really low blood pressure, they'll have what's called pallor, and that is blanching or pale color. If they have a yellow cast to their skin, this can be bad, and it can definitely indicate a liver disorder. Oftentimes, that jaundice is usually seen in the cornea of the eyes. A black and blue mark is a bruise. It's also referred to as an ecchymosis or hematoma, and it's a result of clotted blood beneath the skin. So if you've ever had a bruise, and I'm sure most of you have, you notice that the color starts to change as you heal. So as the clot is broken down, the color of the bruise changes. And then finally, there are brown or black necklace or bruises. And these are areas of hyperpigmented dark areas in the armpit, the axilla, and around the neck. They may be sign of insulin resistance and elevated blood glucose levels.